Hi, I'm Dr. Vishakha.
Hi, this is Dr. Naman Vora.
Today we are discussing about commonly asked questions on TMJ. So, Dr. Naman, what is the difference between TMJ and TMD?
Yeah, so a lot of people have a confusion what is TMJ and TMD. Like many people say TMJ is like teeth, mouth, and jaw, but no, it's not teeth, mouth, and jaw. It's temporomandibular joint, which is this joint which we open and close while chewing and all. Although it affects teeth, mouth, and jaw, and how we'll see in the further discussion. Now, TMJ is a very unique kind of a joint in our whole body system. Like any other joint, like suppose it's a wrist joint or a elbow joint or a knee joint, where right and left are different. But this is a unique joint in a way where when you see here, this is a single jaw, lower jaw, which is also called as a mandible. It is connecting two joints, right and left. So when you open and close, a single jaw movement where it is happening both the sides, right and left. So how it affects is whenever there is some different pull and push of the muscles, it tends to deviate the jaw and its joint. I'll also show you a short video where it explains about how this jaw is designed. So let's see this.
The temporomandibular joint, or the TMJ, is a very complex joint that's located just in the front of the ear. It acts like a sliding hinge and connects your lower jawbone, or mandible, to the temporal bone of the skull. The TMJ is a unique joint because of the articular disc. The articular disc is made of fibrous connective tissue that lacks nerve and
So here, as you can see, there is a disc between the upper and the lower part of the bone. And this disc acts like a cushion. When we open and close, chew our mouth, this acts like a shock absorbing mechanism. Now what happens whenever there is a sudden pull and push of the or a disharmony in the balance of the lower jaw joint, it tends to contract the disc, it tends to allow the disc to slip, and then it creates a lot of other issues which I'll be discussing.
lacks nerve endings and blood vessels, and therefore is insensitive to pain. It acts as a cushion between the two bones. Oftentimes, the articular disc is displaced or damaged. As this happens, the tissue that's supplied with blood vessels and nerves is pulled between the two bones, which can be painful. The dislocated disc can form an obstacle when opening and closing the mouth. The condyle has to jump over the back end of the disc.
You can see here that there is a click which happens. Sometimes many people feel some open and closing movement, it gives some kind of a click. So click happens because of some muscle pull, the disc gets displaced little ahead, and then the bone hits against each other and gives rise to that click. So yeah, this is TMJ, temporomandibular joint, and any disorders associated with TMJ is called as a TMD.
So, a lot of patients they come with a click in a joint, but there is no pain. So, doctor, is it a problem? Does it require any treatment?
Yeah, very interesting question. So a lot of time we get a patient who has some kind of a click, they see some movement restriction in the jaw joint, but I mean they can eat comfortably, there is no other issues associated with. So yeah, number one, if there is a click, that is a sign there is some kind of a disharmony happening in the jaw joint. So some kind of muscle pull which has deviated the jaw a bit, so that's why whenever it opens and closes, it gives some kind of a restriction sound. So as long as pain is not there, that is a sign that joint is getting adapted. It is one of the most adaptive kind of a joint, because throughout our life lot of changes happens when we eat. There is a lot of wear and tear happens to the teeth, and it keeps on changing its orientation. So body tends to adapt it. Our human body is a wonderful most adaptive things in the whole universe. So our jaw joint also gets adapted, but in sometimes it does not get adapted because of various other reasons. I will be talking about various other factors which also affects the TMJ joint, and that gives rise to pain. Pain can be around the ear, or pain can be cervical neck pain, or a migraine kind of a headaches, and also shoulder pain, back pain, knee pain. Yes, these are the also signs and symptoms which can be because of the TMJ related issues. Here I am not saying that all the headaches or all the knee pains or all the backaches are because of TMJ joint, but some kind of a misbalance or a disharmony in and around the joint, which makes the people grind or clench, can affect the spasm in all those muscles. So it is one of the reason, not the only reason. So as long as there is no pain, that means your body is adapting to it. So you just be aware that you have that click. So avoid certain very wide opening movements, like when you are yawning and all. Just support your jaw. Don't put your hand on your face and sleep, because that tends to put a lot of pressure on the joint. So as long as there is no pain, it does not require any treatment. But yeah, just keep in mind and be little observant. Whenever you feel some kind of headache starts, some kind of a jaw pain starts, ear pain starts, some ringing sound in the ear, or neck pain, you just visit a dentist or a doctors who deal with these kind of a treatment.
So doctor, please explain what is clenching and teeth grinding?
Yeah. So clenching and teeth grinding invariably are used terms which are interchangeable, but there's a minor difference between the clenching. Clenching means what? Your upper and lower teeth generally has a space of 2 to 3 millimeters between them. But when you tend to clench, you are just biting very hard on your upper and lower teeth. That gives a lot of contraction in your side jaw muscles, which is called as a clenching. Whereas grinding, where we are moving your jaw side by side like this, which is called as a grinding. Now both can affect your jaw joint. I am not here saying that all people who clench or grind will have some pain or have a deleterious effect on their joint. As I said earlier, that a lot of joint, our TMJ is the most adaptive joint. So people whose joint gets adapted to those changes does not have any symptoms. But there are a lot of people who have headaches, especially headaches on the side of the head, are related to the grinding or a bruxism, it is also called. So I'll just show you a video how that affects your headache.
Bruxism is clenching or grinding of the teeth that is based on the unconscious and repetitive contraction of the very large muscles of mastication or chewing muscles. The temporalis and masseter muscles.
So these are the two main muscles which moves our jaw joint while opening and closing. The side muscle, which is called as a masseter muscle, which also some people who complains of some kind of pain here, and when we check in their mouth, we don't see any kind of a tooth damage or a decay, and a lot of time dentists are surprised like why it is aching them. So it is probably they are grinding or clenching their teeth in night, which they do not realize. A person sleeping next to them, or they might see their jaw movement happening, or they hear some kind of a noise. Usually the patient himself or herself does not realize that they are clenching their teeth in night. And it's only not only the night grinding or night clenching, sometimes in the daytime when you are just busy in some work and too engrossed in some, subconsciously you tend to move your jaw or clench your jaw. That can also give rise to this kind of a pain in the side of the jaw, which is because of the masseter muscles getting inflamed or affected. And this temporalis is a fan shaped muscle on the side of the head. Those headaches, especially in the morning when you wake up with some kind of a pain here on the side of the head, which is primarily because of that overnight you have used that muscle too much, and that muscle is tired.
Can generate up to 150 pounds of pressure between the teeth. This non-functional and continuous contact of the teeth will eventually cause wear on the external hard surface of the tooth, called the enamel. Tooth wear can extend into the soft, inside layer of the tooth, called the dentin. The extent of wear is dependent on the amount of grinding and can be more severe in people who grind in their sleep. When you clench and grind, damaging pressure and forces are abnormally distributed on the teeth. These heavy forces can cause flat front teeth, chipped or fractured front teeth, and teeth chipped at the gum line. Over time,
so as you can see in this video, teeth grinding not only affects these all muscles and the jaw joints around that, but there is a lot of effect on the teeth. Teeth can become flat, it can chip. Suddenly patient comes to us, doctor, I was just eating some rice and all, and suddenly the tooth chipped. It's not because of that time where they were eating it chipped, because years of trauma has made that tooth enamel weak. Enamel, which is the hardest substance in our body, it is even harder than the bone. imagine continuous wear and tear pressure on the tooth can also grind that enamel off. And that other symptoms are like sensitivity or some kind of a pain in that particular tooth where some fracture line has happened and all.
So doctor, why do people generally grind their teeth and clench?
Correct, yeah. So many times we get a patient where it's just say 10-11 years of child and mother or father complains, डॉक्टर साहब ये रात को बहुत दांत ऐसा घिसता है, आवाज़ बहुत आती है हमको. Or there are some adults who, I mean, as I said, person himself or herself does not know, but around people around them, they notice that noise coming or some kind of movement happening. So earlier, people used to blame that clenching and grinding purely on a stress. Like he's taking too much of stress, that's why he's clenching or grinding teeth. Which is partly true, but not completely true. So what happens is, emotions, we have seen some children, especially during the exam period, they tend to clench or grind their teeth too much. So stress is part of it. I mean, a lot of people who are having that stress, they tend to clench or grind more. But what the recent surveys and recent studies are showing that when you are sleeping, the tongue falls back a bit. And when the tongue falls back, it tends to obstruct the airway. And the airway narrows down, and that's where sometimes you hear that snoring noise. So clenching is a kind of a body's protective mechanism in order to open up the airway. So by when you start clenching or moving your jaw around, suddenly the tongue starts coming forward and it opens up the airway and you can breathe. So it's kind of a body's protective mechanism in order to establish the breathing again. Also, there are some research or studies which are showing whenever there is a teeth malalignment or we call it crooked teeth, when the jaw does not fit together well, those people also, or sometimes the wisdom tooth which is coming and there is no opposing wisdom tooth, it tends to come a little more down and it tends to obstruct your jaw alignment or a teeth alignment. That's why there is some premature contacts we tell, and then when you are sleeping, those premature contacts, the body feels there is some food, it tends to grind and clench. So those are also one of the reasons why people clench or grind.
So apart from the teeth and muscles, what are the other body parts where this TMJ disorder affects?
Yeah, so now because of this TMJ grinding and the clenching which it starts because of the disorders, what happens is our body is connected throughout. So there is a bone skeletal system, over there is a muscles, and over there is a fascia. So fascia is a thin a sheet which covers the whole body throughout. And as you can see in this picture, where whenever there is a deviation in the jaw joint, the muscles around gets stretched and pulled at the face level. Whenever the jaw level shifts, the shoulder level shifts, the pelvic, the hip level shifts, there is a knee which gets, so one of the knee gets a little more pressure. The whole body, because of the muscles and the fascia which connects throughout, any imbalance in the body will affect the entire skeletal system. As people say, the jaws and the feet are connected. So this is how people wondered like how I am getting a knee pain because of some problem in the jaw joint. So whenever there is an imbalance in the whole skeletal system, there is more pressure on one of the knee where it shows more wear and tear, and that's how he gets pain. Now also there are people who get some shoulder pain or the cervical pain. So people think yeah, mera posture galat hai because I'm not my working posture is wrong. Yes, posture is one of the reason, but also whenever you tend to clench and overuse your neck muscles, they get tired, and your neck muscles is connected to your shoulder and your back of the dorsal spine. So all those upper body aches. Some people have a stiff neck and difficulty in turning their head. So they think maybe I have taken a wrong pillow or have slept a wrong way. So usually that is not the case. I mean, it's primarily because they have clenched their teeth more that particular night. That's why those muscles are tired and there is a stiffness in the neck. So that's how the TMJ joint and the muscles around it can affect the whole body. And also a lot of people get acidity because of this. I mean, you will be surprised to here that how can acidity be connected to your teeth and the jaws. So the research has shown that whenever you tend to grind your teeth too much, or you're clenching your teeth, these muscles get activated, the muscles around neck and face. So usually when we eat, when we swallow, the neck muscles get contracted, and that's when the stomach gets a signal that food is coming, release acid for digestion. So that's how the normal process. When we eat, food passes through the food pipe, goes to the stomach, and stomach releases acid for digestion. When you are clenching and grinding the whole night and throughout the day, the body gets a false signal that like food is coming, you have to release acid, and that's how you get that nauseatic feeling. When you get up in the morning, you don't feel like eating. So that primarily you have clenched more and your body has released some acid, and we call it a pith in Ayurveda. And those particular patient has a pith prakriti, so their body is too much active and into a muscle contraction stage, which is releasing too much of acid, and they have that acidity. So yeah, there are one number of things which the newer research are showing. It is a kind of having some connection to your jaw joint.
So finally, doctor, can you please explain what are the treatment for these issues?
Yeah. So as we know that TMJ is a very complex joint, and it affects a lot of muscles, the teeth, the headaches, and the acidity, or some back pain, or a knee pain, or a cervical pain, or some ringing sound in the ear. So these are number of symptoms which are associated with TMJ related disorders. Now, not every patient will have all those symptoms. Now, the treatment part of it is designed specific to that particular individual, and there are a lot of treatment modalities available. So first we assess, like, are there muscles affected, are their teeth sensitive, are their teeth affected, is the teeth wear too much. If their teeth wear too much, we give them night guards or splints to wear. If there is a severe derotation on this shifting of joint, we give them the balancing splint. So there are a number of kind of splints which are available, which primarily relaxes the joint and prevents the adverse effect of those heavy clenching forces on the teeth. Now, if there are some other muscle also affected, like neck muscles, the shoulder muscles, then we have a Curalize, this laser, which we give frequent application to those muscles, sore muscles, so they get relaxed. There are a number of exercises which we also show it to patient to relax those particular muscles depending upon where it is affecting their face or the other extremities. Then there are of course those lifestyle changes, the diet, it also plays a huge role. Your gut health, your sleep, your breathing, how you are breathing, your breathing exercise. So there are, I mean, number of, it's kind of a whole holistic approach which we generally advise.